Well, I see it's 10:15, so I'd like to welcome everybody to the webinar on First Nations COVID-19 surveillance and begin with the Traditional Territories Acknowledgement. I'd like to acknowledge that we're all gathering virtually from different parts of Manitoba and beyond today, and that the homes and workplaces that we're joining from are located on the traditional lands of Indigenous peoples. We acknowledge the harms and mistakes of the past and recognize that colonialism and structural racism continue to cause harm today. We dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration, and to disrupt all forms of racism, colonialism, and oppression. A couple of housekeeping things before we get going. We're using WebEx today, which allows you to see and hear the panelists for this session, but the audience cannot be seen or heard. The presentation will be about 30 minutes with some time for questions afterwards. We have the chat function open, and you can find it at the bottom right of your screen for questions. And we ask you to use it only for questions to the speakers about their presentation, or if you have a technical issue you want to flag, because we do have some technical help in the background. Please feel free to type your questions as you think of them during the presentation, and then we can read through them in the question and answer session. And we're scheduled to finish at 11 a.m. So I'd like to start by introducing our speakers. Leona Starr is a Cree woman from Thunderchild First Nation, Saskatchewan, within Treaty 6 territory. She's the Director of Research at the First Nations Health and Social Secretariat of Manitoba, or FNHSSM. Leona is a strong advocate of First Nations self-determination and research grounded in the First Nations principles of ownership, control, access, and possession. She has worked collaboratively locally, regionally, and nationally to ensure that research and information is governed according to protocols defined by First Nations, and to ensure that research involving First Nations is based on a respectful research relationship from the beginning. Dr. Marcia Anderson is Cree Anishinaabe and grew up in the north end of Winnipeg. Her family roots go to the Norway House Cree Nation and Peguis First Nation in Manitoba. She practices both internal medicine and public health as a medical officer of health within the Winnipeg Regional Health Authority. She's the Vice Dean, Indigenous Health, and the Executive Director of Indigenous Academic Affairs in the Ongamizan Indigenous Institute of Health and Healing at the University of Manitoba. Along with many national and international leadership positions and awards, Marcia was named one of the 100 most powerful women in Canada by the Women's Executive Network in 2018. I'll hand it over to Leona and Marcia.
Thank you for that introduction, Marnie. And it's my pleasure to be able to co-present alongside Dr. Marcia Anderson as we share our experience in the First Nations planning and response to COVID-19, and how we've collectively as a region used information sharing agreements to ensure First Nations governance over information and data as it relates to COVID-19. Next slide. So just to give you a bit of background in terms of our organization, the First Nations Health and Social Secretariat of Manitoba was established by the Assembly of Manitoba Chiefs and Chiefs in Assembly. In the late 1980s, AMC was established. It was the successor to the Indian Brotherhood, Manitoba Indian Brotherhood. And it had the mandate to protect and strengthen inherent and treaty rights, to improve the conditions of First Nations people within Manitoba. And under their governance and oversight and their direction given through mandates and by Chiefs in Assembly, we have First Nations organizations that have been established, including the Manitoba First Nations Education Resource Center, and us as the First Nations Health and Social Secretariat of Manitoba. And our focus is really around health and well-being of First Nations. Next slide, please. To give you a bit of background in terms of what our interest has been in terms of providing accurate information, evidence, as outlined by First Nations within Manitoba. since the late 1990s, we've had a oversight committee called the Health Information Research Governance Committee, which was mandated by chiefs in assembly to provide oversight over the first iteration of the First Nations Regional Health Survey, which is this national survey that has been undertaken and led by First Nations across Canada during various waves since the 1990s. We're currently going into our next phase of the RHS. And the RHS is really significant as it's the first of its kind to be designed, delivered, and implemented by First Nations across Canada. In addition to providing that oversight to the Regional Health Survey, the HERC Committee was also mandated to provide oversight over research within Manitoba. In 2007, the Chiefs of Assembly also provided the expanded mandate to HERC to ensure that First Nations research that involves First Nations must follow 3 criteria: to ensure free, prior, informed consent on a collective and individual basis, to ensure that the First Nations principles of ownership, control, access, and possession were adhered to, and First Nations ethical principles were also adhered to. Given the context and the geography of Manitoba, within Manitoba we have 5 distinct nations, and just really recognizing the uniqueness of those various nations within those areas. In 2018, the mandate of HERC was further expanded to include providing that oversight as a gatekeeper of First Nations data at a regional level, and to ensure that the previous criteria was upheld, but also including to ensure that there were benefits directly to community, that research wasn't being undertaken based on the priorities of institutions or academics. Next slide. So if you've sat in for our previous presentations this morning, we talked about how we partnered with the Manitoba Centre for Health Policy to really showcase the accuracy of First Nations healthcare utilization within Manitoba. And we did that through data linkages, linking data, health administrative data to the Indian Status Registry, which is currently the most accurate way of identifying First Nations registered individuals according to the criteria outlined by ISC. It's not the most ideal way, but it's the most accurate way that we have to identify individuals to our status. So we want to be able to utilize data to really highlight the healthcare outcomes of First Nations people. So we've done that through the publication that we released last fall in the First Nations Atlas report. We're going to be presenting some of those findings that focus on the First Nations Children's Atlas. And we have done some of those community-based health profiles based on partnerships with Manitoba Health. And we've been able to deliver community-level information directly to communities, flowing from Manitoba Health to communities. So those reports were delivered last year or throughout the year. And then you may have seen recently, or actually last week, we also released the Diabetes Atlas specific to First Nations under Lorraine McLeod and Dr. Ruth Anderson. Next slide, please. So because we had all these partnerships and established relationships with Manitoba Health and various partners, we also, based on the pandemic of COVID-19, First Nations leadership came together to form what we call the Manitoba First Nations COVID-19 Pandemic Response and Coordination Team. And that brought together some of the chiefs mandated organizations like FNHSSM, and partnered with other political entities like the Manitoba Giwetno Ogamagana, along with leadership from AMC. So it brought us all together under this pandemic response and coordination team. We also brought together members from Angamazon. We also brought members from the University of Manitoba and WRHA and Manitoba Health to really see how we can collectively work together to support communities in their pandemic response. So we meet weekly, almost at times twice weekly, to really discuss what the needs of communities have been and how to actually support them, and to bring together other key people into the conversation, including funders, including governments, in terms of responding to the COVID, or to mitigate the impact of COVID amongst our communities. Next slide. So one of my key roles within this pandemic response and coordination team was to provide support in regards to data and information. And we knew, based on the impacts of H1N1, the impact that H1N1 had in our communities, specifically in Manitoba, specifically the north. We're probably one of the hardest hit areas. And we knew a big piece of that, that response was being able to accurately provide information and data in a timely manner. So what we moved forward with first was bringing together those key partners. So we identified the Health Information Research Governance Committee to seek that approval to start linking data based on our past experiences with linking to data held within the Manitoba Centre for Health Policy. But this was specific to COVID positive results. So we want to use the Indian Status Registry to link to COVID positive results to really identify how COVID was affecting First Nations people, both on and off reserve. And we knew that FNHSSM also had a surveillance strategy that they have employed to ensure that they were getting accurate information, but we didn't necessarily have a clear picture of individuals who lived outside of communities. There's no mechanism or flow of information to say how First Nations were being impacted based on those who live in rural or urban settings. So we brought together, once we had their approval from HERC, we quickly went on to form a data working group, which we continue to meet with weekly, and includes supports from Manitoba Health, their epi and surveillance team, members of their epi and surveillance team from FNHSSM. We also have members of the Manitoba First Nations PRTC team, represented by myself and Dr. Anderson. And then we also have our analysts and members of HERC who also sit there. Next slide. Oh. Thank you. So once we had the approval, just kind of backtrack here a bit in terms of the importance of an information sharing agreement. We sought the approval of HERC based on, we requested 3 approvals. We want to utilize the First Nations data that was collected through the COVID intake forms based on the relationship that, or the space that Dr. Marcia Anderson had created based on the tables that she sat on, to really support the self-declaration of individuals who want to identify as First Nation status or non-status individuals. So not only were we requesting linkages based on the registration of First Nations people, but we want to also capture them based on their self-identification, their ability to self-identify for themselves and to define for themselves how they want to self-identify. We also did some familial relationships or linked to familial relationships based on whether an individual was a sibling or a child to a status or non-status First Nations case. And again, linking to the Indian Status Registry file. And then also that linkage or that creation of that First Nations link file was also governed by an information sharing agreement that was signed between FNHSSM and the province of Manitoba well before this initiative came into place. But this information sharing agreement specific to COVID was the first of its kind, and how quickly it came together is actually really interesting to highlight in terms of how that willingness from partners at Manitoba Health and that willingness for partners amongst First Nations to enter into an information sharing agreement to decide how information is going to be governed, how information is going to be shared, how information is going to be accessed, and to have a First Nations working group that really determines how information is being shared according to our own worldview and lens. Next slide. So what we were able to tell based on the information that we were receiving from Manitoba Health, we could tell whether or not a First Nations, the location of First Nations positive cases. So once an individual has been notified that yes, they are a positive case, we're able to identify their urinalysis by age and sex, whether or not they reside in a community versus outside of community, where they're located, whether or not by tribal council or by RHA. We're able to identify the symptoms that the individuals have been experiencing, any underlying conditions, and in terms of a disease timeline from the onset of symptoms to recovery, and the number of cases overall that have required hospitalizations, the percentage of secondary attack, and whether or not the case has been related to travel. Next. In terms of testing, we didn't necessarily have the testing numbers initially, but after going back to look at the testing numbers based on that information sharing agreement, again, we're able to tell the testing numbers, because currently the voluntary self-declaration of identifying as status or non-status was only on the COVID positive cases. So when we went back to go and look at the testing based on data linkages to the Indian Status Registry file, we're able to tell whether or not, again, those tests were occurring within communities versus outside of the communities, by age and sex. We're also able to tell by tribal council, RHA, and the location of testing sites, whether or not they were in hospitals, COVID clinics, nursing stations, and also the reason why the test was being requested. And again, we can tell a story about the timeline for testing. We can actually try to measure whether or not we have comparable testing numbers to all other Manitobans. And also we look at the number of days it takes for First Nations to actually receive those results back. We're also looking at the number of tests completed for those who have been experiencing homelessness. Next slide, please. And from here, I'll hand it over to Dr. Marcia Anderson to take us through some of our recent releases of our weekly reports.
Thanks, Leona. So I'm not going to go through all of the information that we have access